Hey there, and welcome to the Behavioral Health Matters podcast with Magellan Behavioral Health of Pennsylvania. This is the show that aims to promote positive mental health, increase our understanding of behavioral health topics and services, and reduce stigma. I'm your host, John Lees, and I'm the member and family advocate at Magellan of Pennsylvania here in the Lehigh Valley. On this episode, we'll be discussing recovery and resiliency services at Magellan Behavioral Health of Pennsylvania with our special guest, Steph Cassanese, the manager of Recovery and Resiliency Services at Magellan of Pennsylvania. During this episode, Steph and I talk about recovery and resiliency principles, certified peer support services, and also how the Magellan of Pennsylvania Recovery and Resiliency team supports its members. Steph will also share her own story of recovery and resiliency to provide a real-life example of the impact of these principles and how they shape the work that she and her team does to support Magellan members. Be sure to stay tuned to the end of this episode to learn how you can provide us with your feedback about the podcast and make suggestions for future episodes. And now, here's my conversation with Steph Cassanese. So hello there, Steph, and welcome to the podcast. It is great to have you on to talk with us about recovery and resiliency.
Thank you so much, John. Pleasure to be here.
All right. So to give us a little bit of background, if you could you share with our listeners a little bit about your story, your background, and then also, too, how that kind of fits into your current role at Magellan of Pennsylvania?
Yeah, absolutely. I'd love to do that. I'm going to start with my current role just to kind of level set. So I am currently the manager for Recovery and Resiliency Services here at Magellan, which simply means that I lead our Recovery and Resiliency team. And we'll get more into what that means down the road. But my story begins pretty early in life. I grew up in an addicted household. My mother had an opiate use disorder. And from the time I was 6 until I was 16, I lived in a pretty chaotic, traumatic household. I experienced a lot of neglect. Her lifestyle was not conducive for raising children. And I also experienced a sexual assault as a young girl. I was about 10 when that happened. And that's really molded who I am at this point, working through that trauma. So I was removed from my mother's custody at the age of 16, pretty forcibly. That was also traumatic. And I was sent to live with my dad, who I really didn't know at the time. My mom had kept me separated from him. And so it was really difficult at 16 to do that. I struggled. I had behavior issues. I got pregnant very young. I had a baby at 18, another baby at 24, got married, got divorced, got married, got divorced, had a lot of troubles with relationships, those kinds of things. When the trauma all happened, it was in the early 1980s. Mental health, I don't even think I heard those words. No one offered any counseling. No one offered me a social worker, nothing. It was just remove me from one situation and put me in another. And I just didn't adjust. So I struggled for a long time into my adulthood. And I didn't really understand what mental health even was. It wasn't even a question until I was hired by a community-based mental health organization about 24 years ago now. And I came in at an administrative role. And then in 2006, so I started there in 2001. And in 2006, I was diagnosed with acute myeloid leukemia, which is a very rare and very aggressive blood cancer. And I went through 8 rounds of chemo. I had a stem cell transplant, and I spent 6 months in the hospital away from my kids, away from my family. That was in itself traumatic. When I finally healed and was able to come home, and I was at least in remission at that time, I really had to rebuild my life. I mean, to the point where my muscles were so atrophied from being in a bed, I couldn't even walk 3 steps without somebody holding on to me. So I had to rehab my entire life physically and emotionally and mentally. And it was about 6 months into my remission being home when I started to experience some pretty significant mental health symptoms that I didn't recognize, but I was blessed to have a family doctor who recognized, was very empathetic, and was able to get me referred to a psychiatrist and to a therapist. And for about 5 years, I was on medication, and I really worked in therapy to work through the trauma of the cancer, plus the trauma of my childhood. And that's kind of how I got to where I am today. So I was working for a community-based mental health organization. When I came back to work after my treatment, my supervisor approached me about becoming a certified peer specialist, which we refer to as CPS. And that is an individual who self-identifies as having a mental health diagnosis and or a substance use diagnosis. And we tell our story, and we model recovery, and we help people with our story to show that recovery is possible. So you can see from where I came from, I had a story to tell, and I feel like I was able to help a lot of people in that role. And then when I left the community-based organization and came to Magellan, I came into the Recovery and Resiliency team in the recovery support coordinator role. I worked in that role for almost 2 years, and then I was promoted to the manager role.
So, what a powerful story. Along the way, it seems that really shaped kind of your journey. And in terms of our topic today, recovery and resiliency, I can only imagine the amount of resiliency it required to continue to move forward. But here you are, and we're so blessed to have you at Magellan in the role that you are currently in. We're very fortunate to have you on this episode of the podcast to talk about recovery and resiliency and what Magellan does in the way of recovery and resiliency support and services. So we'll learn more about the overall topic of recovery and resiliency. And we've got you on specifically as someone who, and really I appreciate your sharing your story, because I think it helps to give that background and context for how it is that you, kind of came to be where you are in your current role, and how that helps to inform how you support your team and the work that they do, but also directly our members, as well as other stakeholders, by educating and being willing to tell your story. So I really appreciate your openness to do that. I think it helps, to really provide that kind of jumping off point for us here in terms of the topic for this episode. So thinking in terms of providing some background for the conversation about recovery and resiliency and these services, if you could you provide kind of maybe not a definition, but just some kind of basic information about the principles of recovery and resiliency for the listener?
Absolutely. Obviously, I work for the Recovery and Resiliency Department, so this is what we do. And I feel very blessed to work for Magellan, an organization that puts recovery and resiliency forward in everything that we do, whether it be with members, providers. So I feel very fortunate to be here and to be able to use my story to help others. I don't normally read definitions, but I really love the definition that SAMHSA, which is the Substance Abuse and Mental Health Service Administration, has for recovery. And what they say is recovery is a process of change through which people improve their health and wellness, live self-directed lives, and strive to reach their full potential. And for me, that just says everything about my story. A lot of stories where, you start in one place and you end up in another. And
it's a process, it sounds like, from the definition and from what I know of recovery. It's not necessarily an endpoint. It's a journey. Is that?
It's definitely, there's no destination. I think recovery is a lifelong process, and I think it is a journey. Certainly for me, that's been the case, and that's pretty much what I've seen working in this field. And then resiliency is that ability to bounce back from the things that happen, that go wrong, any type of trauma, or it could be something as simple as a car accident. It doesn't have to be an assault or something like that, or substance use. Recovery can be for really anything. And they've done some research, and it just seems as if inherently we're born. Some people are just inherently born more resilient than others. And I feel like I must have been born with a lot of that, because I survived what most people probably wouldn't have. They
Absolutely.
gave me very little chance of surviving the cancer. I mean, I think they gave me about an 11% chance of surviving. So, but what they didn't realize is I've been surviving my whole life. So when you're in that mindset, it's just another day of trying to survive. So
Yeah.
I have that resiliency, and
Hmm.
that's what I really try to model, because I think
Gotcha.
that's the part.
Yeah.
Without resiliency, there is no recovery. You can't
Hmm.
recover if you can't bounce back. So
That
those
makes
two
sense.
things, they go together. You have
Right.
to have them. That's why we're the recovery and resiliency department, because without one, you don't have the other. And in
Gotcha.
order to be resilient, you have to have hope. Hope.
Can someone build resiliency? You mentioned, people probably, there's a range in terms of each of our ability to be resilient and how much resiliency we have, but is it possible for one to kind of build resilience?
Absolutely. We may be born inherently more resilient, but we can certainly build if we aren't someone that bounces back as
Okay.
easily. Some of the ways that we build resiliency is connection. We want
Hmm.
to make sure that we have healthy relationships where we're around people who are empathetic and caring and trustworthy and treat us with respect, and not isolating. When you're struggling, people are tempted to isolate, and that's actually the opposite of what helps build resilience. You really need to be around people who support you. So, support groups, faith based activities, volunteer work, those kinds of things, their drop in centers, clubhouses really encourage people to reach out to increase their connection. And then taking care of yourself,
Yeah.
taking care of your wellness. I don't know that we emphasize that enough. I know for me, I didn't realize how important taking care of your physical health is to
Yeah.
the rest of your life until I didn't have it anymore. Once you lose
Yeah.
that and you get to a place where you are ill, and so ill that you can't even care for yourself, you realize what I eat, how much I move, whether I sleep enough. Those things are incredibly important. And you can't build resilience if you're not your best self.
Yeah.
So making sure that you're taking care of yourself and that you're using coping skills that are healthy and not
Mhm.
unhealthy ones. Instead of substance use, maybe you go to the gym, or you take up journaling or yoga. Anything that fosters wellness is important, and finding purpose is probably the biggest thing. When
Yeah.
I um, was finally well enough to get back into doing physical things, I had been an athlete in high school, and I really realized that I'd really missed that camaraderie of a team, and just
Hmm.
that being being out and athletic. I had played softball, so being outside was,
Okay.
nature is a big thing for me,
Hmm.
sunshine and all of that. So
Hmm.
I actually decided I was not going to play. I was getting too old for that, but I got my PIAA certification, which is the Pennsylvania Interscholastic Athletic Association, and I started umpiring high school. And then I got my Little League
Very cool.
certification, and I started
Hmm.
umpiring Little League, and
Hmm.
that became a purpose.
Hmm.
I actually umpired in our local youth league here, and I live in
Hmm.
a city.
Okay.
And so I was around a lot of kids who were going through a lot of what I had been
Yeah.
through, and I was able to
Yeah.
be a light. And just, I could sort of seek them out, like sees like, and I could
Right.
see in some
Right.
kids' eyes that they needed that more. And I really felt like I found a purpose. And I continue to this day. That's one of my favorite things when spring comes, to get back out on the field and just be around the kids. And yeah, so finding purpose is incredibly important. Maybe
Okay.
to me, even the number one thing. And then
Yeah.
just how you think.
Hmm.
Um, stinking thinking, they say, and trying
Yeah.
to reframe, and
Hmm.
even the
Does
bad things.
Yeah. See, and you mentioned hope earlier in the process of recovery. So, from your perspective, what role does hope play in the process of recovery?
I think hope is the foundation of recovery. If you really think about, how do you bounce back if you don't have any hope that things can ever be different? And that's the power of what peer support is. Peer
Mm.
support is a living, breathing human being standing in front of you who says, I've been where you've been, or similar to where you've been. And I have come through. Not that I'm better, because
Mm-hmm.
recovery is, you're constantly working on it, but here I am. I am a person who's now a mother, a professional. I've gotten my college degree in the meantime. I have 4 grandchildren. I mean, here I am, a living, breathing manifestation that you can get through the things that maybe you don't have hope that you can. And so we really provide that hope, and that really is the foundation.
And now a brief message from Magellan. If you or a loved one are a Magellan of Pennsylvania member and have questions about services, please visit www.magellanofpa.com for more information. And now back to the show. So within each individual, each of us, we have resiliency, we have the capacity to recover, we would lean into hope and some of the things that you mentioned. I know wellness overall is a concept that's very critical in terms of how things fit together. So is my physical health impacting my mental health? Is my mental health impacting my physical health?
When you mentioned physical health, mental health, I like the model of the biopsychosocial model of wellness, meaning that it's all connected. Our physical health, our mental health, and our environment, all connected to make us who we are. Yeah. I have, when I was diagnosed with the cancer, I needed transplant. So they did a lot of genetic testing. That's why I say that, because they had to see if my sister was a match, who could donate to me. And through that process, when they do the genetic testing, they look for any sort of marker that would have been the reason why I got an illness that really is very rare for a 32-year-old female to get. Yeah. And I had none. And so no one will ever convince me that it wasn't the trauma that caused it, because I know for a fact that it was. I had no other environmental factor. I just... Body holds that. And so your physical health and your mental health are very much one.
Well, that's very helpful to give us this background. And so let's kind of shift gears if we could, and let's get a little more into the specifics of recovery and resiliency and the team at Magellan of Pennsylvania. Can you, and you kind of did this already, but if you could just describe or define what certified peer support is, and how does it intersect with recovery and resiliency principles?
Yeah, absolutely. So certified peer specialists are, again, individuals who self-identify as having a mental health diagnosis, who have been in recovery and who are willing to share their story with others to model that recovery and to provide support and walk next to another person as they find their path to recovery. And there are also certified recovery specialists, and those are individuals who self-identify as having a substance use disorder. And again, are willing to share their story and have been in sustained recovery and all of that. So there are 2 actual under the peer support heading. We kind of default to the peer specialists because that was the original, and recovery support came later. But really it's kind of all the same. It's all under one heading. So that's basically what peer support is. And our team here, the Recovery and Resiliency Department, we are able to provide our members short-term peer support. So our role is to find a member who's in need of additional support, who's already sort of gotten on their road to recovery, where we can sort of step in, stand beside them, help them down that road. And then my team connects them to community-based providers who actually provide long-term peer support or recovery support. And so we will do the referral, and we will walk with that person until they are connected with their community-based peer specialist. And sometimes we even follow them for a short bit longer, just to make sure that all works out.
Make sure there's engagement kind of happening. And
yes, we never want to leave anybody without that support.
Passing that baton, making sure it's
absolutely
good.
So that's part of what we do. And then our team is really involved in pretty much every aspect of Magellan. We're there to provide support to other departments on anything recovery and resiliency related, whether it be language, the most current language, to be sure that we're using recovery focused language, community events. We're involved with NAMI, which is the National Association for the Mentally Ill. We're involved with the Community Support Program, CSP. Many of our our team members hold leadership roles in these organizations. We work on advocacy, going to Harrisburg, speaking with senators. I mean, we're really involved in every aspect of the support that we provide members.
Yeah. I imagine part of that process is also a lot of education related to these services and these types of supports. Not that people don't necessarily know what certified peer support is, but some may not. And even as we're doing during this episode, kind of getting into a deeper dive to help people understand all the different kind of functions and tasks, activities that they can become involved in. But I imagine education kind of sounds like that's kind of a common thread through all those different activities they would engage in.
Yes, we provide both internal and external recovery presentations and training. We tell our story a lot. We educate. You're right. We educate. Certified peer support is really a very new concept. If you're thinking about mental health supports, it's a relatively new concept, and a lot of people aren't aware that it is a Medicaid provided service that people can have. So yes, we do a lot of education.
Okay. And if we could go back a little bit to the team. So your team, can you give a little kind of description of the composition of the team? So where are they situated? I know you talked about some of the activities they might engage in, but just a little more about the makeup of the team.
Absolutely. Very proud of our Recovery and Resiliency team here. I'll start in Cambria since that's where I am. So we're on the west part of Pennsylvania over here, sort of by ourselves. So in Cambria, I have a recovery support coordinator named Natalie Moldovsky, and she is very, very involved in all things county related. She spends a lot of time at our drop-in center here, just meeting with members, talking with them, fundraising, volunteering. She's just very involved in the community here in Cambria. I have then in Bucks County, we have Jenna Woodward, who's our recovery support coordinator. Again, very involved in all things county related, working with other peer specialists, working with members. And then we also have a youth support coordinator in Bucks County, and that's Marissa McKeverkin. And she works with individuals 14 to 26. And provides a lot of support, works on a lot of work groups for youth and young adult peer support, because that's a relatively new concept also.
I was going to ask that. Sorry to cut you off, but that's that population, that kind of transitional age population, I'm sure has a whole set of challenges that they face that may be unique to that process that we all go through transitioning to adulthood. But if there's a complicating mental health diagnosis, that I imagine that type of work is maybe a little distinct in some respects.
Yes, I would say that's a very unique role. And that's, I think, what's so interesting about our team is that even though we're a team, each role is very unique. Each county is very unique in their needs and in their wants. And then in Montgomery County, we have Stacy Bowles, our recovery support coordinator there. And Stacy spends a lot of time focused on the older adult population. He works in initiatives in nursing homes throughout Montgomery County. She works with a lot of older adults who oftentimes are overlooked as needing mental health support. And, that's a population that we're looking to make sure that they have resources also. Oftentimes it's cultural. They're older. They were taught to sort of suck it up and not talk about their problems. And so they might be a little resistant. And then Stacy goes in, breaks down those barriers, and is able to get them connected to resources, which is wonderful. And then we have Colleen McGeehan, who's our family support coordinator in Montgomery County. She works with families, some youth and young adults, and generally works with the younger population in Montgomery, relatively younger in Montgomery County, providing supports in schools, in other, in various settings. So she's very involved. And then we have Janet Verga, who's our recovery support coordinator for Lehigh and Northampton counties. Again, very involved in works with other peer specialists, working with members, county projects, and different events. She's very involved in that community. And that's our team.
That's great. And that's just that word team. And you mentioned, being an umpire and having played sports. So, I imagine, and your role, a part of what you're doing is kind of coaching the team and providing them the support through your expertise within the field as well to help kind of steer the right folks to the right resources and make sure those, that interplay with the community is happening.
Absolutely. I
Yeah.
I look at the manager role in a very servant leadership type. I will never ask my team to do something I wouldn't be willing to do,
Mhm.
and I just believe I'm just a part of the team, just like they are. I'm very, I don't want to say hands off, but I they know what they're doing. They're good at
Mhm.
what they do. Every one of them is amazing with what they do.
One of the questions I was actually thinking about as you were talking is how they work with the community provider. So you mentioned that there's the ability to kind of provide that short-term support and then kind of make sure that the folks are connected with a community provider. Could they could there be interplay with any service provider, not just certified peer support in the community? In other words, could it be outpatient mental health? Could it be other support providers that provide the direct community-based support for individuals?
Yes, absolutely. I'm really glad that you asked that because that brings me to one of the other unique parts of being in the peer support field is that you really wear your heart on your sleeve every day.
Mhm.
Your diagnosis, your story, your emotional health is front and center, and it's exhausting.
Mhm.
Emotional
Mhm.
exhaustion is just as difficult as physical exhaustion. And so we provide a lot of support to provide peer support providers
Okay.
to
Mhm.
their peer specialists and recovery specialists because
Okay.
it is a very emotionally exhausting kind of job. There's a lot of
Yeah.
trauma and compassion fatigue that can happen when you're
Sure.
hearing stories all day long from people who are struggling and you have your own, you know,
Mhm.
diagnosis underlying and you're trying to work through your day and you're trying to support them. So we do a lot of support with peer support providers for
Okay.
sure. We
Mhm.
pretty much every county has a monthly meeting where we're just kind of there to let the peer specialist talk through any issues they're having and just sort of support each other. Or we call them the PDNs, the Professional Development Network. But
Okay.
they're really peer support groups for the people who do the work.
Yeah. Yeah. That's great.
And through COVID, we found that was even more difficult because staffing shortages,
Yeah.
people needed more support. So people were very exhausted and we really take that part of our role seriously. But we
Mhm.
also do refer to really any community-based
Okay. Gotcha.
program. So it could be outpatient,
Mhm.
family-based, any of
Mhm.
those. We're there to provide support for that also. Yes.
Okay. And I guess last question about the team specifically, how would someone get connected with the team, or if they wanted more information about your team specifically at Magellan of Pennsylvania? Is there somewhere they can go to get connected or get more information?
Yeah, absolutely. We have the Magellan of Pennsylvania website. There's a recovery and resiliency page.
Oh,
There's
okay,
a
great.
lot of information on there. There's
Okay,
resources. There's all of the team members' contact information,
okay,
email, all of that. We also have Magellan has a member services line, and you can call that and ask to be connected with the team or ask to be referred to the team. You can be referred through one of our care managers or one
okay.
of our it could be ICC care managers, regular
Hmm.
care managers. That's another way, and you can do it through a provider or through the county themselves. So
Okay.
we get a
Could some
lot of referrals that way.
Gotcha. Could someone call directly, either for themselves or a family member, like
Yep,
if they weren't yet connected with a provider? Okay. So there's really
absolutely.
no wrong door, so to speak, I guess, in terms of how to get connected. There's a lot of different avenues someone can make that connection,
Yes,
which
we try
is
to make it simple to get
important to
them
know.
the
Okay.
support. Yep.
All right, so we'll pivot now a little bit, and let's talk about the impact of the team. So we kind of know what they do and who's on the team. Can you share with us a little bit about the impact of the team? Or do you guys look at either data or, if not data, some mechanism to help define the impact that the team is having?
We do all of those things.
Okay.
As you know, we've changed systems, so we
Hmm.
haven't I haven't had any current data probably within the last year. But yes, and I watch the national data a lot to see what the studies are starting to show about peer support. As I said, it's a relatively new, as far as supports are concerned, it's relatively new. So there isn't a ton of research, but the research is showing really strong correlation between individuals who have peer support, and probably the biggest impact is them being able to maintain community tenure. So less inpatient stays, less higher level of care. So we're keeping them in the community, and they're able to get support where they live. So they're not having to go into the hospital or a rehabilitation center. So I think that's probably the biggest impact peer support has.
Want to know more about recovery and resiliency services at Magellan of Pennsylvania? Well, check out our website at www.magellanofpa.com. Go to the For Members page, and then look under Services and Programs for Recovery and Resiliency. On there, you'll see all kinds of helpful information about the services, as well as how to contact a member of the team in your county. Again, that website address is www.magellanofpa.com. And now, back to the show.
I'm gonna tell a really quick story, if that's okay. But the very first client I got right out of training, or the first person I worked with right out of training, was an older female. And when I went to do the intake, I was still with my supervisor. You had to be with your supervisor for a little while. And but he let me take the lead, and she was sort of talking about the struggles that she was having. And then she mentioned that she was in treatment for stomach cancer. And that gave me the opportunity to sort of tell a quick version of my story of what I went through. And I'll never forget, I will never forget it for as long as I live, her face whenever she heard my story. It was almost like she took a deep breath and exhaled for the first time in a long time. And she just looked at me and said, "You had cancer?" And I was like, "Yeah." And it's that connection to me too.
Right.
Because when you feel like you're the only person who's going through something, it's lonely, and it makes you feel hopeless. And once you hear that somebody else has been there and is on the other side, that just immediate hope. And so to me, that's the impact of peer support.
Gotcha. Yeah, no, that makes a lot of sense in terms of that universality. If someone is, can see others in maybe not the exact scenario, but a similar situation that they're encountering and kind of trying to navigate through, and can lean into that support that's available and be provided that hope that if others can, then I can too. I would think that goes back to what we talked about originally, that concept of building the resiliency and also the concept of hope and its impact on our ability to recover.
Absolutely. Yeah, they've done some research on just the impact of lived experience, and it really is those things we talked about at the beginning. Lived experience increases people's feeling of belonging and connectedness, right? So that connection, finding healthy people to connect with, and it decreases depression, anxiety, and isolation, right? Because you don't feel isolated when you feel connected, and it gives you the opportunity to learn new ways to cope, new ways to heal, maybe things that you didn't think of, and you don't feel alone. So yes, I think that's the impact of peer support, which is the impact of lived experience. It's powerful.
It makes sense. And you're right, it is powerful. Do you do things such as strategic planning or future planning in terms of the team? You know what they do now, you know where their strengths are. There's probably some areas of opportunity that you guys identify. So what type of kind of planning are you all looking at as you look forward?
Always strategic planning, right?
Okay.
You're always trying to determine which direction you're going to go as the year sort of rolls over. And so again, workforce development and retention is a really big focus.
Sure.
As with everything, I know we're not unique. COVID was a hit on the workforce. It was a hit because people burned out. So there weren't enough to go around. And so one of the focuses this year, probably our most important focus, is going to be really working with our counties and working with our providers to see what we can do to help increase the workforce, support trainings. We're going to provide some curriculum to help prepare people, because oftentimes somebody's says to somebody like they did to me, you should look into being a peer specialist. You'd be really good at it, but you have no idea what you're getting yourself into. Right. And then maybe you get out and you're like, oh, this isn't what I thought it would be. So we provide that, education piece to individuals who are thinking about getting into the peer world. So we do a lot of that. That is going to be a really big focus in 2024. And then we work really closely with our national recovery and resiliency team. So Magellan's national team. And we have some initiatives going on this year. We're working on a provider-based training that's going to be available online it's really just going to be a language education, making sure that we're using recovery-based language, making sure that the providers are very focused on the recovery and resiliency principles and all of the services that they're providing. And the other big thing that we're working on that probably no one knows about yet, but I'm working with the national R&R director on a newsletter it's going to be national. So we're going to have stories from all of our different locations.
Oh, that's great.
Idaho, Nevada, New Mexico, Virginia, all of us. And just we're going to talk about recovery and resiliency principles and provide resources and just tell stories and testimonials. And so I'm really excited.
It's awesome. So really what I'm hearing, in addition to all that wonderful work that's going to be happening in the future, your local Magellan of Pennsylvania Resiliency and Recovery team is very integrated with the larger Magellan Recovery and Resiliency team. It sounds like there's a lot of support there. There's a lot of collaborative work that's happening.
Yes, we work very closely with the national team and with the other states that we are in. Magellan of Idaho, Magellan of New Mexico, Magellan of Nevada. We work really closely. We all support each other. Again, a very unique situation where you are every day talking about the things that have happened to you and trauma. And it's really important to have that support. And so we do support each other and we work on projects and anything to promote recovery and resiliency. We really, this is again, a relatively new concept, recovery and resiliency. It's not based on the medical model, right? This is more the newer model of whole person care where recovery and resiliency has come in. So there's a lot of education that needs done. A lot of people are not familiar or don't really understand what peer support is. And so working with the national team allows us to have extra resources and to really be able to highlight the recovery and resiliency projects that we're working on. The states oftentimes come in and provide feedback. And one of them is that adding some more recovery and resiliency to principles to other teams. And so that's another project that we're going to be working on as a national team and part of why we're developing this training.
So no shortage of work to do in the future, right? The to-do list is full.
The list is very full.
Yeah, it sounds that way. So listen, I really just want to thank you again for coming on the podcast to kind of, number one, tell your story. And again, I really appreciate hearing your story. It's very powerful. It really helps to illustrate, the concepts of being resilient and moving forward through extraordinarily difficult and challenging circumstances, and the concept of hope as well. And then, being willing to share that along with helping us to get an understanding of the work that's happening at Magellan with recovery and resiliency and the team here in Pennsylvania, and just a larger effort to really make sure that recovery and resiliency are a big part of the work that's happening, not just at Magellan, but also through our providers that provide that direct care to our members. So again, I really thank you for being willing to come on and talk. And again, just thank you so much. Appreciate it.
Thank you so much for having me.
Stay tuned. We'll be right back to wrap things up. So what did we learn on this episode of the podcast? Well, we learned that recovery is possible. And we also learned that resiliency and hope play critical roles in one's recovery. We also learned that Magellan has a recovery and resiliency team nationally as well as here in Pennsylvania who are dedicated to serve and support Magellan members. And lastly, we learned that you can connect directly with the team to request their support or to find out more about the type of support that they provide. We'd like to thank our guest on this episode, Steph Cassanese, for sharing her story and telling us all about the Recovery and Resiliency team at Magellan of Pennsylvania. We'd also like to thank all of you for listening to this episode of the podcast and invite you back for our next episode. If you have any questions or feedback about the podcast or have suggestions for future episodes, send me an email directly at jglees@magellanhealth.com. Well, that does it for this episode. I'm your host, John Lee, saying goodbye for now, and please remember, behavioral health matters.